Hi class, welcome again to another session on rehabilitation engineering. So today let us discuss calipers, or at least a few of them, and if required we split this topic into a couple of videos to cover all types of calipers. So calipers are basically orthoses that are used on the lower limb. So you have the foot orthosis, which just covers the foot. I mean, like which supports the ball of the foot and the arch of the foot. Then you have ankle foot orthosis, which supports both the ankle as well as the foot. Then you have knee ankle foot orthosis, so it supports the knee, ankle, and the foot. And like the name suggests, you have the hip, ankle, knee, foot orthosis, so it supports the entire lower leg. Right, so let us have a look at them one by one. Before that, like any other medicine, orthosis should also be prescribed. And when you go to a doctor, right, the doctor does a thorough evaluation and blood tests if required, and then prescribes medicine to you, right? So, as a rehabilitation engineer, when a patient comes to you, you have to make sure that you prescribe them an orthosis, or you suggest them an orthosis that is going to augment their impairment in the best possible way, right? So for example, if a person has issues only with the arch of the foot, you wouldn't want them to be wearing a hip, knee, ankle, foot orthosis, provided unless the problem with the arch is actually causing problems in the hip, right? So you have to do a thorough evaluation before you give away an ankle for give away a caliper. So there are certain guidelines or certain rules that you need to keep in mind before prescribing a caliper. So the first one is that the specification of the orthosis should include the nature and number of joints. So when I say nature, it means whether the joint is a hinge joint or a ball and socket joint or condylar joint and so on. And then the positioning of the straps in the suspension and accessory attachment to the shoe or the boot, right? So shoe is something that covers just your foot. Boot will be covering till your shin or something. It's like the Wellington boots that people wear during rainy season or for gardening. So basically to walk in puddles. So therefore the orthosis should consider the nature of the joint, the number of the joints that it is going to support, the positioning of the straps in the suspension, because you need something to tie the orthosis to the body, right? The orthosis is not going to be self-adhesively clinging to the body, right? So you need some sort of adjustment that is needed, and that should be taken into consideration. And then accessory attachment to the shoe or the boot should also be taken into consideration. The primary reason for prescribing an orthosis should be explained to the patient, because if you go to a doctor and they just write 15 medicines and say like, okay, take all these medicines and you'll be fine, but you would want to know exactly why you're taking so many tablets, because psychologically you feel that the more tablets you take, the more ill you are, right? So you would want to know whether your illness is that serious, or whether they're vitamin tablets to support, or whether they are antacids or whatever, right? You would want to know all these details. Like you would want to know exactly what is the composition of each and every medicine, but at least you would want to know exactly what medicine is taken for which purpose, right? So similarly, if you explain to a patient like, hey, hang on, if you wear this orthosis, it is going to aid you do such and such job better than what you are able to do now. So then the patient would be more open to accept the orthosis, because already they are psychologically affected with their disability, and you do not want them to wear a device that is going to make them more self-conscious, right? So if you explain to them why exactly they need to be wearing the device, then that would increase the acceptability rate, and that would help you in that would help them in rehabilitating better. So before you prescribe an orthosis, you need to run certain checks. The first one is to assess the stability of the hip and the knee, and it should be evaluated in order to decide how high the caliper should be placed, whether it's okay to go on with a foot orthosis, or an AFO, or do they require support to the knee and the hip as well, in which case you refer or prescribe a KAFO or a HKAFO, right? So muscle grading should be done, and attention should be paid to the hip abductors, extensors, and the knee extensors, right? All these muscles should be specially taken into consideration, and you should grade these muscles. You've got guidelines to do so. You've got the MRC scale, which is the Medical Research Council scale for muscle grading. So based on that, you do certain tests and see how what is the strength of that muscle, whether they are able to resist a particular movement against gravity, and so on. You've got quite a lot of MRC scale is explained very well in the literature, so I'm sure if you go and see that, you'll be able to figure out what exactly it is. Then next thing is that you have to check the alignment of the leg, right? The ankle should be aligned with the medial malleoli. The knee should be aligned with the prominence of the medial femoral condyle, and the hip joint permits the patient to sit upright at 90 degrees. While seated, the hip joint should be able to permit a person to sit at 90 degrees. So this is some alignment that you need to check before you prescribe a caliper. If you don't check this alignment and you prescribe a caliper, then there are chances that the caliper would do more damage. Like it would probably increase or aid in the disability rather than resisting it, right? Lastly, a caliper should be functional throughout all the phases of gait and the static and dynamic alignment. Right? Caliper should be a functional device. It should not be an ornamental device, or it should not be something that is worn just because the rehabilitation engineer thinks that the person should wear a caliper. Right? It should have a functional movement, and it should aid in functional movements of the patient. Right? If it is not aiding, then it is better not to prescribe it. Just leave the patient alone. I hope you had a very, very fruitful session having an introduction about the calipers. We shall discuss more about calipers, like the different types of calipers, in the subsequent videos. I hope you take care till then.